My name is Carrie Lee, and my ID number is P1097128. And today I'll be talking about best practice in health and care. So let's get straight into it. Evidence-based practice. What is evidence-based practice? Evidence-based practice is a research and is based on research and evidence which would lead to the best way to treat the patients. So basically, it means when health professionals make a treatment decision with their patient, they base it on their clinical expertise. Evidence-based practice and evidence-based decision is based on external evidence, internal evidence, patient preferences, and patient values. But I'm going to talk about the patient preferences and the patient values, because the patient has to be at the heart of the service, right? So the patient preferences is what does the patient really want when given several different options. If the patient does not want the type of care that we are recommending to them, then that care cannot be instituted. And patient value would be the quality of life. Right. We're gonna move on to the next page. Now, there are different types of evidence-based practice. There are quantitative research, qualitative, and systematic. And it's important that we know the difference between the three. Qualitative research is when we look at the interventional studies and outcome research. It is the type of study you do a lot of statistical analysis with. Qualitative research is really done to understand the human behavior, how people are responding to their situation, etc. And systematic research, that is known as the IS, and systematic research review bring the same level of rigor to the reviewing of research that has been done on a specific topic. Now we're going to talk about evidence-based practice, and we're going to give example to an organization which I chose the NICE guidelines, the National Institute for Health, and it is a departmental public body of Department of Health in the United Kingdom, and it establishes guidelines in 4 areas. And that is like the 4 areas are health technologies, clinical practice, public sector workers, guidance for social worker. But I'm not gonna explain too much into that. NICE is an institution here that carries out assessment for the most appropriate treatment regimes for patient diseases. For example, a patient with cancer would not only require treatment to improve their health. The most effective method of patient care not only includes meeting their physical needs, but ensuring that their emotional, psychological, and spiritual needs are met. And NICE does this so that patients could get the best possible result for care, and also economic arguments regarding different treatments. Now we're going to talk about the principles and purpose of research. What is research? And the purpose of research is about learning new things and finding new things. It is about broadening our knowledge and opening our horizons, as well as advancing our knowledge. Research is about finding out new knowledge that could lead to changing in treatments, policies, or care. Research might be concerned with preventing disease and promoting good health, or finding out people's experience of different services and support in the community. And now we're going to talk about the process of research. So basically, the process of research, the first thing here, we're going to identify the research problem. And basically, we're going to keep in mind the very foundation is what the research problem is. Once you have reviewed the literature, then you would identify the research, then one conduct the review of the literature. Then, once the literature is reviewed, then you would determine what the literature purpose is. Then we would move on to collecting data and analyzing and interpreting the data. And that's the process of research. Now I'm going to talk about skills needed to conduct a literature review. A literature review is to find previously published scholarly work that is related to the topic. Skills needed to conduct a literature review. Personal skills would be background knowledge, how to update knowledge, previous research experience, handling data. And personal would be like how to research using the appropriate search methods, writing skills, confidence presenting, and extended knowledge. Qualities needed to conduct a literature review. So basically, what research questions are, I think these would make up the qualities. What are you asking it? Asking, has anyone else done anything similar? Is your research relevant to research practice theory in the field? What is already known or understood about this topic? How might your research add to this understanding or challenging existing theories and beliefs? Ethical issues. Sorry, guys. So, ethical issues. What is the right way to go? Ethical issues can be described as the moral codes of practice. This is the principles which guides a person's behavior. Laws, regulations, policies, and procedures are set in place to protect both health professionals and patients. Ethics. So basically, it would be deemed unethical for pregnant women or young children to participate in drug trials, because pregnant women would not only be taking risks with their own health, but that of their unborn child too, and young children are unable to participate in such trials. Own personal skills and knowledge in being able to conduct a literature review. And my own personal skills, and that's interpersonal skills. So basically, I am a quick learner with the ability to adapt to change promptly. I have demonstrated this because I've started the course last week, and I've adapted to the class and the situations and the people. Commitment. I am committed, and I've also demonstrated this because I am able to achieve deadlines and reach. I'm able to achieve targets and reach deadlines. Organizational skills. I have the ability to be systematic and efficient. I have demonstrated this by planning my time and workload. Writing skills. I have demonstrated this by completing the task at hand. And communication skills. I have the ability to communicate effectively from one group to another through the use of manual understood signs. Oh yeah. Thank you, guys. If there's any questions, then I'll be happy to answer. Thank you.